Welcome back. Viewers, we've been talking about how the approaching winters, the increasing pollution, cold season, as well as the festivals pose a big challenge for our country. And especially for those regions that do see a lot of pollution during winter season and the cold temperatures. Specifically, let's talk about Delhi for a bit. Let's take a look at the AQI data, the pollution level in Delhi just in the last 1 week, and you will see how the air quality has consistently now worsened. And post Dussehra today, it was a very, very bad day, a literal toxic hell for the city of Delhi. The AQI on 19th of October stood at about 269, which by itself is poor quality air. And we now, by 24th of October, had reached 396, very poor quality. By 26th of October, which is today, we had hit over 400, severe. That's the level of pollution. Now, keep this in mind. Let's also take a look at what's happening as far as the COVID cases in the national capital are concerned. 19th of October, the positivity rate, which is a direct reflection of how many people are tested and of those, how many actually test positive for COVID, 5.97% was the positivity rate as of 19th of October. By 24th of October, it had gone up to 8.16%. It's consistently gone up. It's been a big jump this week gone by. From 23rd to 25th, on 25th of October, it was 8.17. So the positivity rate going up along with the cases shows you that more people are testing positive now for coronavirus. Now, could this be a reflection of us letting our guard down during festivals? Could this be a reflection that in winter season, in the cold temperature, people do get more vulnerable, people are more susceptible to coronavirus? Could it be a direct correlation to the worsening air quality as well? Or is it too soon to say? Let's ask the experts. This needs to be treated as a warning for what may be coming up in the next few weeks. Let's say good evening to Dr. Jugal Kishore, Head of Community Medicines Department in Safdarjung Hospital, Dr. Chandrakant Pandav, former Professor and Head Center for Community Medicine at AIIMS, New Delhi. Let me start with Dr. Jugal Kishore first. Good evening to you. Dr. Kishore, can we make this direct correlation between worsening air quality and rise in COVID cases? Or what are the other reasons for what we are seeing in Delhi right now?
As we have the previous experience of the flu, and during the winter season, the number of respiratory disorders increase manifold. So it was expected that maybe the COVID case will also go up. So you can say the winter has a relationship with the respiratory disorders, and if we have a higher number of pollution, then definitely it increase further. So nothing we can say extraordinary. It is all expected. Every year we are facing respiratory disease, but yes, COVID case increase is not only just because of the air, but also at the same time we have the winter, and in winter we have the air pollution, which is leading to respiratory disorders.
Okay, let me also ask Dr. Chandrakant Pandav. Dr. Pandav, how do we read this data, the rise, the slow rise in cases, in positivity rate, as winters settle in the national capital?
First of all, let me set the context. I have great reservation, and I've been repeatedly writing to the various government, including Government of India, that the cases detected we have not done in a systematic way. Cases tested and cases detected, the methodology we have used is extremely arbitrary. But assuming that is the truth, what you said very well, madam, that it's not a single. The word is not correlation; it's association, and it's not a single association. The multiple factors which you have very succinctly put it, you have put it very well. One is festival season, overcrowding, face down, mask down, and fourth is the AQI. Movement in the city has increased. As you can see, we are back to normalcy in terms of good old days. I think one thing human beings have learned not learned from the history is that they have not learned anything. This is a classical example of this particular example. We have not learned anything from the history. I think we are digging a suicidal trap, suicidal creation. I thought that after being exposed to corona epidemic, we will learn from it. We will learn to respect the nature. We will learn to respect animals. We will learn to respect plants. But we simply have got a very convenient and a very short memory.
So what do we do? Is it on is the onus on people? Is the onus on the state right now? Do we have to collectively come together? What should be the precautions we take so that this situation doesn't get out of control? Delhi, I have to believe the numbers, Delhi did manage to get a hand on the COVID situation in terms of the cases. Overall in India, we are seeing a decline in cases. Dr. Pandav, let's begin with you.
Madam, I have been historically given a classical example of triangle, which is moving the mountain. And which are the three elements of triangle? It's statesmanship, society, and scientists. And there's a simple exemplary rule in our medicine that what can be measured must be measured. Now let's look at the statesmanship. The Honorable Prime Minister has actually given us the right policy directions. I'm a big admirer of him. He is the public health practitioner, not of the century, but of the millennium. Because since 2014, he has started a number of schemes, Swasth Bharat, Swachh Bharat, which we have been waiting for centuries, Rashtriya Poshan Mission, with which I am associated, Ayushman Bharat, Beti Bachao, Beti Padhao. These are public health measures which India has been waiting for last 75 years. And Honorable Prime Minister has done. Sir, congratulations for this exemplary statesmanship and leadership shown. Now coming to the scientists. We as scientists must record this data in a systematic, comprehensive, representative way. Assuming that it is that way, it's our duty to put this data because it's the informed data that's going to make informed decisions. Third is the society, and that's where the entire burden lies. The government has its own role in terms of creating a level playing field, facilitated environment. The scientists have its own role in terms of measuring and conveying the truth. For the society, the major thing is lack of awareness. How much time and effort in this entire corona journey we have spent on health promotion? Maybe 900 crores. How much are we spending on vaccine? We are spending 90,000 crores. In levels of prevention, health promotion is the single most important. But historically, ma'am, we have laid insignificant attention to health promotion because it's not glamorous, it's not very visible. But the cornerstone, the foundation of the entire thing has to be health promotion. Thank you, ma'am.
I just want to also read out some data and various research reports that have come across the world. A Harvard University study actually shows that an increase of only 1 microgram per cubic meter in the PM 2.5 level, which is also what we measure here as a reflection of the air pollutants in the air. Just an increase of 1 microgram per cubic meter is associated with an 8% increase in the COVID-19 death rate. There was another study done by UK, the UK's University of Cambridge, that found a link between the severity of the COVID-19 infection and the long-term exposure to air pollutants. Imagine that. When it comes to long-term exposure to air pollutants, who knows it better than many of our cities, especially in northern India? A study from Italy showed that higher mortality was reported from regions where air pollution levels were high. Another research from Europe showed that 78% of all COVID-19 deaths were reported from 5 regions in Italy, France, Spain and Germany where the levels of nitrogen dioxide was high. Then again, it brings me back to the same question. How do people living in such cities where pollution is high tide through this year? Dr. Jugal Kishore, we are hoping by next year this time more people will have access, we will have access to a vaccine. But this year, how do we tide through it?
Thank you for your question. I will say that around 10,000 to 11,000 liters of the air we are inhaling every day. And any deviation in the composition of air as far as the, it's oxygen, carbon dioxide, monoxide, or maybe particulate matter, it is having devastating effect on the body because minor particle like 2.5 or less than that, it goes to various part of the body through our lungs and the blood, and affects our arteries and also the tissues. And that is why we have effect not only just the lungs but also the cardiovascular system, and also to our progeny like the newborn children. They are also dying. So we can expect, yes, if there is a damage in the respiratory system, then the corona can definitely have the more effect, and the mortality can increase. As we know that cardiovascular and the diabetic, these all things are increase the mortality rate in the population. In the world over, almost 6.7 million people are dying because of the air pollution, and India itself is contributing almost 1.9 to 2 million deaths due to air pollution. So it's a big amount, and the total burden of the disease due to air pollution is 11%. Like the indoor air pollution is almost 4% and 7% out ambient air. So if ambient air combined with the household the pollution increases, then more and more damage to the lung occur. Now we should how now the next question is that how we have to handle this all, because as the November and December we are going to have more and more pollution. It may reach to even 800 and 900 where it becomes totally toxic. So there are major contributor, and the contributors are like our vehicles. If during this period we can decrease the vehicle load on the roads. Also the air traffic. Fortunately, this time we don't have that much air traffic, but air traffic contribute huge amount of the carbon dioxide and the other pollutant in the air. So we require total shift of our development of our life. Then only we can handle this kind of air pollution which we are going to witness in coming time. And because of it affects our body, it affects our lung and heart. That is why the COVID mortality could be much higher.
So, I mean, one would assume, Dr. Pandav, that those who already have respiratory issues will be the most vulnerable. Would you like to, just tell us a bit more about it so that people are also aware? Are there certain age groups, or those who already have some other preconditions who will be more vulnerable now to coronavirus?
I'm telling you, we are scripting a great tragedy because of our behavior. I thought the corona period had given a chance for some reflection, introspection, but we seem to have failed to use this opportunity. The external journey has been stopped because of the various reasons. My colleague Dr. Jugal Kishore said this corona gave us an opportunity for internal journey. Now, what I have learned from this internal journey is the following. In Sanskrit, we have a Purushottama, where the Sanskrit slok says that when you do yajna, you pray for human beings, you pray for animals, you pray for plants and flowers, and not only that, you also pray for inanimate things as well. Now we seem to have slipped out of this historic, culturally rich concept. Human being is so selfish and so self-centered that they are not prepared to have collectively conscious to address this issue. So once again, I'm coming to the same point. We need to change attitude, no matter which latitude, longitude, or altitude you're sitting. Attitude changing is a very challenging process. For that, we need specialized disciplines like social and communication behavioral sciences. And nobody is patient enough to give sufficient inputs for it. Ultimately, ma'am, it's all about behavior and change in behavior. The short answer of going to vaccine only.
Yes, and a lot of the responsibility, I think, also comes on us.
Yes, it's a collective
Correct. A
thing.
lot of the responsibility, I believe, Dr. Pandav, will will also have to come on us. And I want to use this opportunity to again emphasize on what even the Prime Minister said last time about being careful this festival season, being not letting our guard down. Now I would add to it and say, well, that's not just about saying that, okay, let's not step out without our mask, or let's not forget social distancing. Let's also not add to the pollution, because pollution is going to be a big trigger is becoming a big trigger, as the numbers are showing to you right now. The air quality coming down and the number of COVID cases going up is a big trigger for more COVID cases. And if that is what it is, then the people living in these cities cannot afford by any standards to be adding to their pollution problem, be it by use of their own vehicles, be it by resorting to using fireworks during Diwali or any other festival season or festival that may be coming up, be it by open burning of dried leaves or whatever else, be it by breaking rules in running industries and paying bribes to the officials to continue running these industries or carrying out your construction work, adding to the pollution. In every aspect, the entire society and government together need to come together to reduce pollution level this year. The fatality will be us, our children, our elders, our people who have respiratory conditions already. Let's not make coronavirus a bigger challenge than it already is, viewers. The choice is as much as ours as it is for our governments to ensure they do their job. The example of the last 1 week in Delhi shows you that this is going to be a serious problem this winter season. Thank you so much for joining us on this conversation. A big thank you to both of our panelists as well.